All right, today we're going to do a little review on ethical practice in nursing. We just talked about this a couple weeks ago, but ATI says you guys are not doing very good. So maybe we need to cover some of this again. Okay, so we know that ethical issues in nursing are complex. There are a bunch of different situations where you're going to have to consider ethical principles in order to make the best decision for your patient, your family. The American Nurse Association has a code of ethics. You should all get on the website and look up that code of ethics. It helps to guide your practice, how you provide patient care. It helps resolve ethical dilemmas. If you follow the ANA code of ethics, guides our ethical decision making process and allows us to be advocates for our patient, which are all foundational principles that are the reason why nurses are the most trusted profession year after year in this country. We'll talk about the specific principles coming up. All right, this first one here is easy. Autonomy. Autonomy is the patient's right to make their own decisions without coercion. So, an example of this is the nurse upholds autonomy by providing patients with all the information about their treatment options and then respecting their decision, whether or not it aligns with what we think is best or medical advice. So, an ethical consideration is the nurse is struggling because this patient is making a decision that might be harmful or doesn't align with medical advice, but we're going to respect their autonomy as long as they have full decision making capacity, because we know this is an ethical, foundational consideration that we should allow this patient to make their own decisions. Beneficence here, this is another easy one. The definition involves doing what will benefit the patient, promoting their well being, ensuring positive outcomes. An example is giving a patient pain medication on time, promptly before they suffer too long unduly, and benefiting them by relieving their pain. Ethical consideration relating to this principle might be that beneficence doesn't always align with what the patient wants. So respecting their autonomy while also promoting or practicing beneficence might bring you into some ethical dilemma. Like if we know what's right for the patient, what will help them, but they want something else, and we need to respect their autonomy. So it's not always cut and dry. And confidentiality, this is an easy one, right? The obligation to protect the patient's personal information. We understand this, the HIPAA laws, doing what's right for the patient, not sharing any information with anybody not involved in the patient's care or authorized to receive this information. So nurses, you must, be diligent about closing your computer screen, not talking about patients in an area where others might overhear it, like in the hallways or the break rooms or the cafeteria, and just making sure that you're only involved in sharing critical information that's on a need to know basis with authorized people. So, fidelity, the definition of fidelity is being loyal, truthful, keeping your promises um, that you make to your patients, which will help build trust, build a nurse patient relationship that is positive. So, some examples of this might be you tell your patient you're going to come check on them before lunch, that you actually come check on them before lunch. You're going to bring them pain medicine in an hour, you come back within an hour. So, keeping your promises. Obviously, you can see how breaking this ethical principle would create some distrust, not a positive relationship between the nurse and the patient. Uh, you have to be careful with making promises that are difficult to keep due to the demands of working on the floor. Sometimes I say I'm going to come back in an hour, and then there's a full arrest. And it's so just be careful, make sure that you're communicating appropriately and making the right types of promises that you can keep. Justice is another ethical principle. Basically, the definition of justice is treating everyone fairly and equally. Uh, this is going to come up in nursing when we're talking about like the distribution of resources and maybe medical insurance coverage. So, do people deserve to be treated differently if they can't afford to pay for their insurance? As far as the American Nurse Association is concerned, no. As nurses, we need to treat everybody the same, distribute our resources, which is basically our time and care, So give nursing care that is unbiased, unbased on anything like race, ethnicity, ability to pay. As nurses, we treat everybody the same fairly. This can come into practice when you're talking about prioritizing patient needs, to make sure that, just because somebody's 100 years old, it doesn't mean that, we should cut off our resources or not give them quite the attention that we would to a younger person, because they have longer to live, or treating a patient who is an inmate a little bit different than treating somebody who isn't, based on the fact that they might have done something in their past that doesn't really align with what you believe is the right way to live. But as a nurse, you're going to treat everybody the best you can, provide the best care you can, no matter who, what, where, when, or why. Non-maleficence, this is an easy one, so do no harm, right? Making sure that we're not doing anything that's going to produce or create any unnecessary harm or pain to the patient. We're doing what's right. So things like ensuring you're doing all your medication checks and rights before you give the medicine, to make sure you don't accidentally give the wrong med or dose and cause harm. An ethical consideration, sometimes harm or pain is unavoidable, like when we're going to give medications like chemotherapy that are going to definitely cause you harm, pain, um, all of the side effects. But we're weighing that with beneficence and deciding what's the best route, to have the most positive outcomes. So paternalism, this is kind of a new one to me. Definition is making decisions on behalf of another person, assuming that those decisions are in the best interest of the patient. So as a nurse, you can be practicing paternalism, or as a family member, maybe someone is acting, making decisions in their patient, their loved one's interest, and we need to be aware that this, is an ethical principle, and we should try to align this with the definition of making the decisions in the best interest of the patient, not the best interest of us or the family or anybody else, but of the patient. One example is withholding a terminal diagnosis from a patient who might be, particularly vulnerable at that point in time. That might cause them more harm. But the dilemma is we're infringing on that patient's autonomy. They should have all the information to make their own decisions. So again, there's always a push and pull to this. One principle is going to affect the other. Veracity. The definition of veracity is truth telling, um, requiring honesty in all interactions with the patient to maintain trust and ensure informed consent. It's pretty easy for us to try to whitewash facts, or potential side effects or problems, or the status of somebody as a nurse, because you want to follow the beneficence principle, where we're going to not stress them out. We're going to relieve their apprehensions. But lying to someone, not telling them the full truth, maybe about their diagnosis, how serious it is, or how tough this procedure is going to be, how much pain they're going to experience, is not following the principle of veracity. You have to kind of weigh the benefits versus the risks. I always try to follow the principle of veracity, even when it comes to somebody who's knocking on death's door and they ask you, am I going to die, am I going to be okay? It's the instinct to tell them, no, everything's going to be fine, we're going to take care of you. But you're following this principle, you should tell them exactly where they are, allowing them to make their informed consent decisions based on the truth. So, in conclusion, following the ethical principles outlined for us in the American Nurse Association Code of Ethics, also in your textbooks, ATI is a good reference. You're going to ensure that you're practicing nursing the way it was intended, and in a safe way that's going to protect your patient and also protect you and your license. If you're following these codes, and if you can refer back to them to justify your decision making process, then you have some ground to stand on, in order to defend your decisions, because not everything is black and white, cut and dry. And often you'll see that these ethical principles work in opposition of each other. So you need to be really confident and have a good understanding of these principles in order to practice ethically, which is the goal for all nurses.